still continue our rigorous surveillance of communities and special settings such as homes for the elderly and infirmaries to ensure early detection and mitigation. While we are still in the midst of the pandemic, Madam Speaker, indications are pointing to some success in the management of the spread of the disease and its impact on the health system. We have, through the strong support of the healthcare workers on the ground, not seen the buckling of the health system under the pressures of COVID-19, even though we have had periodic concerns. We have also maintained over time infection rates below 2.5 per 100,000 of population, as well as positivity rates of between 8 and 10%. When compared, Madam Speaker, with international benchmarks, Jamaica can be said to be one of the countries that have been able to manage well the risks that are associated with the pandemic. There are, however, worrying signs. Based on our current assessment, the parishes of St. Ann and Manchester are showing signs of uncontrolled spread. The health departments in those parishes have already begun to ramp up prevention activities with testing and contact tracing, especially for the vulnerable populations. Community interventions, which are key components of the response, have also been initiated with activities in town centers and in at-risk communities. It is at this time that we say to citizens, Madam Speaker, of these parishes that you can reduce the spread of disease through your actions. Pay close attention to the infection prevention and control protocols. Wear your mask, keep physical distance, stay away from large crowds, and wash your hands or sanitize as often as possible. The development and swift global deployment of safe and effective vaccines against COVID-19 is essential to containing the global pandemic. The Ministry has been advised by the COVAX facility that the first batch of vaccines has been increased from an original figure of 1% on that date or that month to 5%, which represents, Madam Speaker, a total of some 292,000 doses, enough to vaccinate approximately 146,000 Jamaicans. We have been able to negotiate vaccine dosage prices of some US $10.55 per dose, reduced from the going average price of some $35 per dose. This price is negotiated, Madam Speaker, for 16% of the population and represents phase 1 of Jamaica's vaccine rollout plan. Within this first phase of the program, priority will be given, Madam Speaker, to the following groups and individuals. And this again is not unique to us. It's a case across the world. Healthcare workers, frontline workers, that is healthcare workers, elderly, 60 years and older, the JDF, Jamaica Defense Force, the JCF, the Jamaica Fire Brigade, the Department of Correctional Services, and our customs officers at our ports of entry. Infirmaries, members of parliament, senators, parish council representatives, and other senior members of the state, residents and staff of nursing homes, and institutionalized individuals, that is, persons in the penal institutions. This, Madam Speaker, this number, based on our assessment, represents some 440,000 individuals. Through vaccination of the elderly, we will immediately cauterize the number of persons who have negative outcomes due to an infection of the COVID-19, and by vaccinating our frontline workers, greater levels of service delivery can be realized through the reduction of their risk profile based on an infection. Agreement has been made to explore bilateral arrangements with countries that have indicated their willingness to partner with Jamaica to ensure the safe vaccination of our population. Accordingly, the Ministry of Health and Wellness, in collaboration with the Ministry of Foreign Affairs and Foreign Trade, will begin the process of exploring how we can leverage our international engagements to secure additional supply access for safe vaccines. It must be understood that the Ministry of Health and Wellness will maintain its very rigorous process of review for all medical supplies that are administered within our jurisdiction. For the granting of emergency use authorization, the vaccine must meet one of the following criteria, Madam Speaker. Be included, firstly, in the World Health Organization emergency use listing for prevention of SARS-CoV-2 infection, COVID-19. Secondly, the granted authorization for emergency use for prevention of COVID-19 by one of the following stringent national regulatory authorities of reference: the U.S. Food and Drug Administration, the FDA, Health Canada, and the European Medicines Agency.